So let's actually start talking about the mechanism of action, how stimulants are proposed to work. And it kind of feels a bit counterintuitive that something that would increase the availability or the utilization of stimulating neurotransmitters like dopamine, like norepinephrine, would cause benefit in someone who has symptoms of ADHD. That being said, it has to do with where and how it works, right? Methylphenidate works essentially by increasing the availability of our neurotransmitters, particularly things like norepinephrine and dopamine. And when they're made more available in a certain part of the brain, this front part, right, our frontal lobe helps with decision making, focus. It helps with what we call executive functioning. And a lot of what ADHD symptoms are kind of correlated with is basically dysregulation in our executive functioning, this kind of, reward-seeking behavior, inability to control impulses, etc. So by increasing the activity, the availability, the utilization of these neurotransmitters in that part of the brain, we can actually help improve things like emotional regulation, impulse control, etc. So methylphenidate is a bit more specific. It doesn't do as much when it comes to its mechanism of action compared with our amphetamine products. Our amphetamine products work by also enhancing release of these neurotransmitters. They work in various spots within the neuron and synapse, right? So there's a selective inhibition of dopamine and norepinephrine presynaptic reuptake. So kind of like with our antidepressants that are SSRIs, serotonin reuptake inhibitors, that make more serotonin available for the neurons to use. This does it with norepinephrine and dopamine, okay? Amphetamines decrease the reuptake of dopamine and norepinephrine, but it also essentially enhances the release of these, of these neurotransmitters. So we're getting kind of a squeeze out of those neurotransmitters and a blockage of the reuptake, that recycling of those neurotransmitters. So when we increase the amount of dopamine and norepinephrine that's available in the prefrontal cortex, we see a resultant improvement in symptoms of ADHD. So things to think about when we're talking about stimulants. The stimulants that we're talking about specifically here for treatment of ADHD are Schedule II substances, which means that there's a high federal regulation on them in terms of how much you can prescribe at once, the prescription monitoring required for it. It's designated as a high-risk product for misuse, dependence, etc., but also has a medically recognized use. Right. So something, say that's a Schedule 1, has a high risk, but also no recognized medical use. And there's the challenge with stimulants is the amount of formulations. It's a beautiful thing because it's necessary, because we're really trying to tweak, dosing and release formulations to match the individual's needs for symptom coverage. But it also makes it kind of tricky, right? In general, I do prefer extended release formulations in most situations. It helps with adherence. It's funny, a lot of people with ADHD have trouble remembering to take that second dose in the afternoon, or, having that consistency. So there's a lot of improvement in dosing, adherence with extended release. We also see less up and down, less like slamming on of the effects. So when you have more of a smooth on and off, people tend to have improved tolerability, as well as it decreases the abuse potential, because the faster an onset of something like this, the faster your brain gets, that increase in dopamine availability, the more rewarding that feels and can increase potential for abuse. We do see less challenges with things like neuropsychiatric side effects with methylphenidate versus amphetamine. So we see less in instances of mood lability or mood up and down, less tics, less anxiety, less instance of psychosis, but a lot of these are actually quite uncommon. We also have lisdexamfetamine, which the most common brand name associated with lisdexamfetamine is Vyvanse. And Vyvanse is unique because it's a prodrug. It has to actually go into the system and go through the liver. So it goes kind of through what we call our first pass metabolism, and gets broken down into an active formulation. So individuals can't do things like insufflate or snort lisdexamfetamine effectively. They can't inject it effectively, and it has that kind of slower uptick in terms of onset. So a lot of times for adults, we like to try Vyvanse. A lot of people do well with that sort of smooth on and off that they see. Other things to think about when it comes to administration of stimulants. So in the morning, if someone's taking their stimulant in the morning, they should have some essentially consistency in what they're consuming food-wise. If an individual has a higher fat content meal when they take their stimulant, that will cause a delay in the absorption. So the peak will be later on. So when we're fine-tuning those dosing, that could potentially be an okay thing, but if it's caused by the meal that the individual is consuming, they have to be consistent there. If we're using the transdermal formulations, stuff that's pretty typical for utilization of transdermal, so avoid applying to irritated skin. We want to rotate the patch around. But what's nice about things like the transdermal formulation is you can kind of self-titrate the duration of action a little bit by removing the patch earlier if you want the kind of offset of effect of the medication to happen sooner in the day. Again, we want to just make sure that we are maximizing symptom coverage and minimizing adverse effects. So typically you will look into your package insert or your resource for starting medication doses, start at that recommended dose, and titrate often at weekly intervals until you see the desired response balanced out with adverse effect management. So looking at general warnings, we'll get into products in a bit, but looking at general warnings, boxed warning for our stimulants, that high potential for abuse and dependence. So it is something that needs to be taken into consideration. And sometimes there's family diversion as well. So a kiddo might be prescribed a stimulant and a family member may be misusing it. So just being thoughtful about those potential risks that come along with it. And particularly with our amphetamines, there's additional risk when it comes to things like cardiac complications. So it has a higher risk when it comes to potential for increasing blood pressure, sudden cardiac death, cardiovascular events. In most individuals, if they're otherwise healthy, not a big concern. But if someone has a history of congenital heart defects or conduction issues or a family, like a first-degree relative family history of sudden cardiac death, really before the age of 50, then we have to be a little bit more concerning and diligent about utilization of amphetamine products. Other things to be concerned about: substance use disorder, as mentioned before. There are some concerns with hypothyroidism and how that can affect response to treatment. If someone has a history of hypertension or tachycardia, high heart rate, we do have to just monitor closely. If someone has a history of tics or psychosis or seizures, there is a potential risk for these products to worsen those. So it doesn't mean they can't use it, but we do have to monitor closely and make sure that the individual is educated about that. Peripheral vasculopathy, so it can constrict the veins, right? So if someone has, for example, Raynaud's, which is when you kind of lose blood supply usually in the extremities. It can worsen things like Raynaud's. If someone has other types of peripheral vasculopathy, it can potentially worsen those. And like with many mental health medications, because brains are very complicated and weird and sometimes respond to treatment in unpredicted ways, there are some reports of increase in things like suicidal thoughts and behaviors from these medications. So always looking closely for those incidents.